Richard. So over to Richard as the Director of Policy and Practice at UNICEF.
Thank you very much, Larry, and thank you to ODI. Thanks to Bella for the session, and Save the Children for the partnership. Let me start by saying there's been much progress on the Millennium Development Goals agenda since the baseline of 1990, and we need to recognize that. But we maintain now that it's essential to look beneath and beyond the global averages and drill down. And if we don't drill down as systematically as we can to look at what's happening at local level as well as at national and global levels, we risk declaring a statistical victory but incurring a moral failure. And that is our central argument. Very much in line with what Claire was saying, and I believe what Patrick will say, that we need to look both at aggregate progress and at distributional issues and disparities together. The Progress for Children report that we're bringing out today, and some accompanying analysis that our Executive Director, Tony Lake, will launch later today in New York, lay out the available disaggregated data, which is incomplete, but it is substantial, and looks at the picture that both the national and global average data present, as well as what we can learn from disaggregation, particularly from household surveys such as the demographic and health surveys and the multiple indicator cluster surveys. And the report makes both a moral and a practical case for putting the most disadvantaged families, children, communities first in priorities and spending. It concludes that without a stronger and more explicit equity focus, we may well arrive at the 2015 marker for the Millennium Development Goals, while at the same time leaving large numbers of children and families and whole chunks of societies behind and out of progress. I want to stress as well that through independent research, we've reached almost exactly the same conclusions, both in terms of policy but also statistical analysis, as Save the Children and ODI have reached. So by independent means, we've come to very much the same conclusions about this overall picture of progress on a number of the Millennium Development Goals, and certainly not all of them, but even where progress has been attained, inequalities have not been resolved, and in many countries and for many indicators have tended to worsen. Let me just give a few examples of the data to illustrate this. On primary schooling, MDG 2, yes, we've seen enrollment increase globally. We've seen the gap between girls and boys narrow, and we've seen another phenomenon which has been very heartening, which is the gap between children who have been orphaned and children who are non-orphaned in terms of school enrollment also narrowing. It's become very close. So the orphans have caught up, and we can attribute that mainly maybe to policy interventions. But despite this overall progress, we still have a 14 percentage point gap between rural and urban in terms of primary school enrollment, and we have a 26 percentage point gap between the lowest 20%, the lowest quintile in terms of wealth, and the highest quintile. And this is based on analysis in 43 countries. So the wealth gap, if you like, the gap between the likelihood of a child in the poorest 20% of families going to school and the richest is still very significant. Second illustration, percentage of children under 5 who are underweight. More than 2 times more likely to be underweight in the poorest quintile of households compared to the richest. Yes, we've seen overall progress, about a 5 percentage point improvement to 26% of children underweight globally in the developing world. Still not good, but at the same time we still have that twice as likely for children in the poorest quintile of families to be malnourished. And when it comes to, I think, probably our flagship indicator, and we think it's a global flagship indicator, child survival, under 5 mortality. If a child doesn't survive after 5, then you can forget talking about development at all, of course. Yes, we have seen historically unprecedented progress globally since 1990, a drop from 90 deaths per 1,000 live births among under 5s to 65 deaths per 1,000 live births over 18 years, coincidentally the lifespan of a child. We've seen the aggregate total drop below 9 million since records started being, or estimates started being made of global child deaths, below 9 million, still 9 million too many. But we have this incredible concentration now in Africa and Asia, 93% of global child deaths in the continents of Africa and Asia. And less than a third of countries, and this is where we share the same analysis, less than a third of countries have demonstrated both reductions in child mortality and closing of the inequalities. So most countries have not managed to pull off that trick of both making progress and closing the gaps between the poorest and the richest quintiles. So that means that still today, a child born in the poorest households in the developing world is 2 to 3 times more likely to die before his or her 5th birthday than children in the richest 20% of families. For all of these reasons, and because what underlies these types of figures is a complex interlocking of poverty, gender, location, often ethnicity, we feel a more systematic and more explicit equity focus in policy is essential. We did some modeling, and we looked at different approaches, an approach that is broadly the same as the current approach, which is already pro-equity to some extent. And then we modeled an approach which would add on additional features to focus more on the poorest families and communities. And we found that because the greatest needs are concentrated in the poorest families and communities, the payoffs will also be higher if you invest in basic services for those families and communities. Because the poorest households have a preponderance of child deaths, stunting, undernutrition, and children out of school, if you concentrate the additional investment in those families and communities, you'll get a bigger payoff. So we're saying it's not only right in principle, based on a human rights approach, based on equity and justice arguments. It's not only right in principle, it's right in practice as well. Our modeling suggests that it'll be more cost effective and that the gains will be higher from concentrating investments among the poorest families and households, which is a bit counterintuitive because people come at you with arguments, oh, it's more expensive to reach the hard to reach, they're more remote, they're more difficult to reach for some reason or other. But in fact, our modeling at least suggests that you will get more, if you like, bang for the pound, since we're on this side of the pond, or bang for the buck than you will if you continue with conventional approaches. What would this more strongly pro-equity approach look like? Well, we haven't completed the story on that, but it would include certainly removal of user fees, and as many of the barriers that can be removed, which prevent or discourage poor families from accessing available basic services. Cash transfers certainly come into the picture, outreach, mobile facilities, child health days, and certainly removal of fees. Secondly, communication with families to support them improving their own practices, such as breastfeeding, weaning, hand washing, malaria prevention in the household, rehydration, and so on. And thirdly, certainly investing in the services in the poorest communities, upgrading facilities as well. So there are 3 strands to what we're suggesting, certainly for maternal and child health, nutrition, water and sanitation, would be a more strongly equity-focused approach than we have now. Removing the barriers to poor households, outreach and communication in support of poor households, and upgrading the facilities that serve the poorest communities. Let me conclude by saying that there needs to be clearly, and I think this is obvious to many here, a wider policy environment that supports a pro-equity approach. One is making use of the complementarities with basic education, as has already been discussed, but in basic education, helping children to learn, not just to attend school, which is the MDG indicator, but going beyond that to look at the quality of schooling and the quality and achievement of learning. And one way that we've piloted this, I should say gone beyond piloting because it's now a national program in many countries, is the child-friendly schools approach, where schools actually welcome children rather than deter them from attending and from learning. The second element is the protective environment around the child to remove the risks and the vulnerabilities of exploitation, abuse, and violence. This is obvious if children are going to survive, to be well-nourished and to learn. And then thirdly, as has already been said, partnering with communities, supporting community-led initiatives and communities' own efforts and investments in the health and education of their own children. I should say lastly that thanks very much to Larry for the piece in The Guardian this morning. There's a tremendous need to preserve the increases in national budgets that have already been registered and to take those further, to build on them, despite fiscal constraints that countries may be facing. The best possible investment that countries can make is in their own children, and it will be foolhardy as well as unjust to cut back on those investments in times of temporary fiscal austerity. Thank you.
Thank you. Patrick.
Okay, thanks, Larry.